We're covering needle gauge and length selection for the phlebotomy certification exam. This topic is critical because choosing the wrong needle can compromise sample integrity, harm the patient, and result in an automatic failure on your exam and in a clinical setting. The exam will test your ability to match the correct needle to a specific patient scenario. For a standard healthy adult with good veins in the antecubital fossa, the 21-gauge needle is the go-to choice. An exam question might describe a routine blood draw for a 40-year-old male and ask you to select the most appropriate gauge. 21G would be the answer. A 22-gauge needle is slightly thinner and is used for smaller or more fragile veins, common in older adults or patients with difficult venous access. The exam might present a scenario with an 85-year-old patient with thin, delicate veins and ask for the best option to prevent vein collapse. The 22-gauge needle is the correct choice. For very difficult draws, such as on the back of the hand, or for pediatric patients with very small veins, the 23-gauge butterfly needle is typically used. The exam loves to test this, often asking about blood draws on infants or patients with extremely challenging veins. Now, let's talk about needle length. The standard length is 1 to 1.5 inches. A 1-inch needle is for most routine draws, while the 1.5-inch needle is reserved for patients with deeper veins, such as in cases of obesity. A common point of confusion and a frequent exam trap is the relationship between the gauge number and the needle's actual size. The higher the gauge number, the thinner the needle. To remember this, use the mnemonic, gauge goes up, girth goes down. This simple phrase can save you from making a critical mistake on the exam. The most significant clinical consequence of poor needle selection and a major topic on the exam is hemolysis. Hemolysis is the destruction of red blood cells, which can falsely alter test results, especially for potassium levels. This is often caused by using a needle that is too small, like a 23 gauge for a standard draw, or by pulling back too forcefully on a syringe plunger. An exam question might describe a sample that was rejected for hemolysis and ask for the likely pre-analytical error. The answer would point to using too fine a needle or excessive pressure during the draw. For example, forcing blood from a syringe through a small needle into an evacuated tube is a classic cause of mechanical trauma to red blood cells. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.